Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Michael Hasbany, the president of Healthmine, and we're going to talk a little bit about member engagement and how to get these members to see their primary care physicians. Michael, thanks for being here today.
Thank you. Glad to be here.
Let's start off with, what are some of the biggest challenges? We know members need to get in and see their primary care physicians. What are some of the biggest challenges the plans are seeing with getting them there?
Yeah, it's a great question. So just a little background, I had not been in the member engagement space until the last year or so, and I've been in the analytics space for a long time. And, we took this position that these health plans need to run all these analytics and profile their membership and do all this expensive work and load data and manage the data. And then after they do all that work, and I'll give you some examples in a minute, they end up having trouble actually doing something about it, right? And it's a big issue in our industry that I didn't recognize until I got to Healthmine, is that there's very, very little do, and there's a lot of looking, and analyzing and no action. So to me, you're spending millions and millions of dollars on your membership and trying to get your patients to go see their provider, but it's too much friction in the system for you to even make that active.
Are you seeing, I know there are a number of ways that you can get a member to engage and get into these doctor's offices. What are some of the traditional ways, maybe some that are not so conventional, and what's working?
Yeah, again, to me, it seems to be an interesting space depending upon the market you're in. If Medicaid's much different than Medicare and ACA is different. For example, Medicaid, if you have 100 members in your plan, you can spend a tremendous amount of money making phone calls. Phone calls are very expensive. I didn't realize it, but again, they're very, very expensive to make outreach. You can send mail to these individuals, right? It's hard to text them and email because their contact information is never really correct. So just imagine you have in a closet, a clothes, and you spend all this money on your outfits, and then you only wear 2% of what you spent all this money on. And that's a really good example of member engagement in the Medicaid space, is you have 100 members, and you spend all this energy, effort trying to reach them after you do all these analytics to get to 2% of them to actually go to the physician. And that's the traditional way. You have all these members, and okay, let's just do more cowbell. Let's call them more. Let's send them more letters. And same goes for ACA market. Like, you do the same work to get 11, 12% people actually take an activation and go to the doctor. And Medicare is much better, and you're in the mid-20s. But still, imagine spending 90+% of your time doing something that doesn't drive any behavior. And so when you're doing that kind of work, you say, okay, how do I raise that by 1%? Like 1% makes a huge, huge difference to these health plans. And they're doing it not because they don't want utilization. They want people to go to the physician. They want to manage that disease burden. And so what we've done is look at different ways to drive that behavior with AI and some other member engagement. So I'll give you a quick way to look at that. For quality engagement, right? Inovalon, best quality engine there is, bar none. Like, there's nobody better. 180 million lives go through that system on a monthly basis. And all that measurement goes on for no action to be taken. That's crazy. So we've taken the approach saying, let's develop a way that I can run my HEDIS measures, or I can shoot for stars. I'm going to go after some star measures in the numerator. And what do I do about it? Load it directly into a system like ours that we can take member engagement and action, so it's automated and I don't go through this massive process of just taking guesses over and over again. So I hope that answers your question. That's one of the biggest challenges we see in the marketplace, and we're trying to make that change.
That absolutely answers the question. I think, if we can take it a level further, what does that really look like? So, you're putting something into a tool and it's helping. Tell me a little bit more.
Yeah. So I think we're going to talk a little bit about it later, but I'll give you a great example of that is, let's say that you run a colon cancer screen campaign, right? And you want to get these people to take the test, whether we do that with Exact Sciences, which we do a lot of that kind of stuff. And when our member campaign goes out, it can go out SMS or email. When they click on the actual schedule now or actually get the kit, we actually drive them into another modality. Or if I want to drive them to an annual wellness visit and they say, okay, schedule me now, it doesn't go into some long process where someone has to make a phone call and find what provider's in their network and then call that provider and find out the next available date. We send you an active link. You click and tell me, okay, yes, this is me. I like this doctor, or find one within 15 miles. Schedule me within the next 30 days. That's fine. I'm available Mondays, Tuesdays only between 1 and 6. and schedule it, our system will go and find that provider, and if it's not available, find the next local provider for you in your network, schedule it, and text you back. And then our system will do all the work of calling each one of those members, those physicians' desks, and getting the availability and getting that scheduled, all through an automated AI system. So it doesn't mean that the patient spends all that time doing that. It's a completely different way than the conventional way that you've seen people do it, and the cost is much lower. And now, of that 90, if 100 people are making that call, I'm not spending 98% of my time making expensive phone calls or letters. I'm trying to do it a different way to say, okay, this is a better way to scale it, that I can hit a bigger number of people, knowing that my costs are only limited, so I could only hit a smaller number the old way. I hope that makes sense.
It does. I mean, and now you've got the member who's having a more positive experience. They're going to be more likely to get into their doctors, and you've got health plans who are freeing up not only cost, but time to focus on, actually, that's my question. What are health plans able to kind of refocus their energy on now that they're saving the money, but what are they focusing on without having the kind of administrative burden of all of these other channels of outreach?
Right, so think about this. If you're a health plan, you're trying to go for 5 stars. And it's very difficult for you to know what those 5-star ratings are, because you have to look at things called cut points. Where am I compared to my peers in this market for these critical measures, triple weighted, double weighted, whatever they are? If you're spending so much energy just producing the rates and then like basic comms that go out to the member to get them to go to the doctor, and you don't have any time to say, I really need to focus on these 50 people for this measure, this 75 people for this measure, this 200 people for that measure, that's what we enable people to do. Say, okay, I've released the pain of just doing general comms, and now I can do that. Plus, I can actually move cut points, and I can actually afford to go after the stars ratings that I pay all these consultants to tell me what I should do. I get to go do it now. That's the difference of what we can do for people.
Okay. Well, Michael, this has been a great conversation. I appreciate you taking a few minutes to sit down with me today. Anything else you want to add before we wrap up?
No, I really appreciate it, everybody, but please come visit us. And Healthmine is really doing some great things in the marketplace, and I appreciate Inovalon asking us today. So thank you.
Absolutely. And thank you to our viewers for tuning in today. Be sure to stay tuned for our next episode of INOvators.